Hello everyone, Dr. Kimball here. I am coming to you today to talk about part 3 of our 7-part series, how to fix your bulging disc. So, you've got a bulging disc, you know it, it's causing you some kind of problem. You either have immense amount of back pain or your leg is just killing you and you've never had this before, you're totally frightened, you don't know what to do. So what do? You go to YouTube and you start getting all this information about, hey, you don't need surgery, you should do this, take this pill. This is going to give you all the answers that you want. So I've already gone through parts 1 and 2. Today, this is literally probably the most important conversation because this is the one that's going to keep you out of my office. And even though I'm a surgeon and this is how I make a living, I just want people to get better. And if we can avoid you from having surgery, that is 100% my goal. So what's the science around fixing your pain and rehabbing your pain and getting you better without surgery? It really is about the physical environment surrounding your spine. So your spine has had some focal either tear in the disc or disc bulge or whatever it is. We cannot, hear me, we can't fix it. We can't go back in time. We don't have a process to actually inject a new cartilaginous cell into your disc and grow it back to normal. We can't do that. So I'm telling you what's going to happen, very much like a tire on your car. It's going to continue to wear out. All right? Well, all right, great, Dr. Kimball. How does that help me right now? So your pain right now is related primarily due to some sort of exacerbation or inflammation that's occurring. It could be a chemical irritation from the disc that's torn and is leaking some inflammatory fluid that is irritating your spine, nerves, and or back. That's going to take some time. It could be that the disc is collapsing and now you're having some bone-on-bone phenomenon that is causing some pain. Your only option outside of surgery and replacing that disc with a new disc, and that's a big deal, is to strengthen the supporting structures around your spine. That is one option. The other option is to reduce the amount of stress that is on your spine. Yes, you're interpreting that properly. You have to lose weight. Unless you are already in the lowest area of the BMI, body mass index category, I'm sure that you can lose some weight. Start with 10 pounds. It might be that you need to lose 60 pounds. It might be that you need to lose over 100 pounds, okay? You don't want to hear it. I'm sorry, I'm the one that's telling you. You already knew it though. So, weight loss. And how do I lose weight, doc? Because my back hurts so much I can barely walk or I can't get out, and all the exercises that I used to do hurt so bad, so I can't lose weight. So what do? You get depressed, you go home and you eat, and then it just gets worse. So don't do that. You're going to have to make some changes. Diet and exercise are the only solutions. If you can't get out on the exercise equipment or go walking or jogging, if you can't do that, maybe you can try a bicycle. Maybe you can do an elliptical. Most patients can do some form of aquatherapy, water-based or anti-low gravity type of therapy. Usually doesn't hurt your back to get in a pool. Yes, not a lot of people like doing exercise in the pool, and no, it's not only for older population silver sneakers, okay? That's not it. You can do it, and if you can't do something else, this may be your only option. So please listen to me. Please try something. It could be as simple as trying to swim. Hey, you can't swim, that's fine. You can get in the pool and you can walk laps. I can even show you some exercises that you can do. You can sign up for a water aerobics class. You may be the only 40-year-old in that class. That's okay. No one's going to make fun of you. All right? That's something that you can do on your own, weight loss and exercise. Number 2, getting you into a qualified physical therapist that knows what they're doing, that is comfortable treating and evaluating and taking care of you with regard to your spine. Now, physical therapy, it's not massage therapy, it's not chiropractic therapy. These are different disciplines. You may get a little bit of decompression at your physical therapist. You may even like your physical therapist because they give you some massage. That may be the reason why you even go. But that's not why I'm sending you there, not to feel good. I'm sending you to a physical therapist so that you can get some tools, some training, and some professional advice to help you strengthen your core and your low back. If you don't do that, you're not going to be in a better spot to support the spine that is starting to show signs of degeneration. You gotta do that. If you don't, you're gonna have problems. So just to recap, this is the most important thing you can do to take care of your spine. I will tell you there are other things out there that can provide you symptomatic relief. We'll get into some of those things: medications, injections, steroids, anti-inflammatory medication, chiropractic, acupuncture, acutherapy, cognitive therapy. There's lots of things that you can do, and I would say none of those things are off the table. The only bridge that you cannot uncross is surgery. All of these other things you tend to be able to back out of, okay? Or they don't cause a permanent injury or a permanent modification to the anatomy of your spine that you can't recover from it. Most of them are helpful in one form or another. I don't, nothing's off the table for me, okay?